Hi, my name is Jeremy Whittle, Psych of 111, and I'm a certified nurse assistant. I work with the elderly in long-term and hospice care, and I was recently disabled in an auto accident. I'd like to talk to you about my observations of losing independence and the emotional impact of being dependent on others from experience as a dependent as well as my experience as a caretaker. I think it's safe to assume that most of you watching this are taking this course as a prerequisite for the nursing program and will spend your career with people who are dependent on you. Due to my experiences, I feel it's my duty to get across to you the emotional impact you as caregivers will have on your patients. As people age, our bodies start to deteriorate, and in late adulthood, we lose the ability to take care of ourselves. Imagine slowly losing your sight, your hearing, your ability to move on your own, and even literally losing your mind. After age 70, about 10% of North Americans have trouble carrying out ADLs or activities of daily living. Eating, bathing, brushing your teeth, or even getting a glass of water becomes something we have to rely on others for. You no longer get to eat when you're hungry, bathe when you're dirty, or drink when you're thirsty. Your freedom is gone, and your survival now depends on when somebody else has time for you. As a healthy 26-year-old male, losing my left arm and left leg the use of, was one of the worst and most educational experiences of my life. Losing my job, having to drop out of school, and relying on others financially, as well as for survival, pales in comparison to what the elderly go through. As a caregiver, providing and assisting a patient with ADLs is the job description, but it's only bare minimum. The dependent elderly rely on their caregivers for emotional support as well. As part of my training in Alzheimer's disease, the most common form of dementia among elderly, I've learned that it doesn't matter what reality is, it just matters what their reality is, and whether they're happy or not in that day, in that moment, whether they remember it or not. How they are treated by their caregivers and how quickly they respond to their needs can easily mean the difference between enjoying the rest of their lives or being miserable until they're gone. Too often, I've seen caregivers do bare minimum at their jobs, and I've experienced this as a patient. One night, after my surgery, I laid in bed with a C-spine immobilizer on, or neck brace, and couldn't turn. I became ill from the anesthetics and aspirated on my own vomit while the nurse stood there and did nothing. Due to the economy and a recession-proof healthcare industry, people are flooding the nurse field, and I fear the humanity of a caregiver will be lost, and the people who really need us will suffer the most. Whether you go on to become a caregiver or not, please remember that the elderly have worked long and hard and have been through a lot to give us the world we live in today, and they deserve our respect, our kindness, and our care.